Ted is calling on that line in Cherville, Indiana. Go ahead, Ted.
Hello. Good morning.
Morning.
You know, I'm a senior citizen. I get a report from the Medicare booklet every year. The first page says acupuncture is not covered. I'm a retired doctor, and I learned acupuncture from China. I see quite a few patients a day. And the reason patients come to see me, they don't want to see the acupuncture because they have no insurance coverage. The Medicare not covered. For example, a man have a backache, lower backache for years, for MRI done, injection done, surgery done, there's still backache. So what the man's supposed to do? Because acupuncture will not be paid by Medicare. If you pay by Medicare, there'll be 1/10 of it expenses. And why I never heard anybody talk about like these programs, which I watch every day. Never talk about acupuncture. Why?
Max Richtman.
Well, first of all, I have to say that I'm a little biased about acupuncture. My wife is a holistic veterinarian, has a clinic in Bethesda, and does a lot of acupuncture, and I've seen miracles, real miracles on animals that were treated by acupuncture. That's a slight aside and a plug. But there are many improvements that need to be made in Medicare, we feel. Eyeglasses are not covered, eye care, vision. Hearing aids are not covered. Dental is not covered. These are so important to seniors, to their quality of life. And we have been talking to other groups and trying to build coalitions to improve Medicare by adding benefits. It's a tough thing to do in these economic times. But let me just go back to the Affordable Care Act, because there were additions in benefits that are new, that I think seniors are not aware of, and they need to be aware of them. For the first time since Medicare was created, preventive care, screening, testing, no out-of-pocket costs paid for by the Medicare program. And this obviously has, I think, a long-term savings if medical problems can be detected early. Chairman Ryan's budget, all that is gone. All that is gone because the Affordable Care Act is repealed. So there have been some, I think, very important improvements in Medicare. The donut hole will be reduced and eliminated over a number of years in the Affordable Care Act. So I think the Affordable Care Act began to make improvements while saving money for Medicare. So we know it can be done.
We understand that your committee will be starting a new television ad here shortly in the Washington, D.C. area. What will be the ad? What will the ad be about? Why are you doing it? How much money are you spending?
Well, I'm not sure. We're negotiating with the broadcast and cable networks, and I don't have a figure, but let me say it's more money than we've ever spent, and we have spent money on ad campaigns. And the message in the ad, we want people to understand that these programs, yes, they're for retirees, they're for seniors, but they're for families. Families have a stake in these programs. You know the term FICA. I don't know how many people know what that means. It's Federal Insurance Contribution Act. Social Security is insurance for families. Not just for seniors. It's there for seniors, and the trustees have told us just last spring the program is sound, able to pay every penny beneficiaries are entitled to until the year 2036. There are some issues that need to be dealt with, but they're long-range issues. But about a third of Social Security benefits go to non-retired workers, survivors, spouses. I think 5 or 6 million children get by in life because of Social Security. Our message in these ads is these are programs that benefit families. And yes, they're important for retirees, but everybody's got a stake in these programs, and we need to get our priorities straight.
So what are you calling on those that are be watching the commercials to do?
Don't cut Social Security, don't cut Medicare. These are too important. We have to have the as I just said, there is money to do the things that need to be done. It's just a question of convincing the majority in the Congress and the White House that a priority should be placed on protecting families, protecting their health care, protecting their retirement security. That's our mission right now.
Senators Lieberman and Coburn yesterday unveiled their bipartisan proposal for reforming Medicare, raising the eligibility from 65 to 67 over 12 years. Would you support that?
No, we wouldn't.
Why not?
It's already hard enough for seniors to make ends meet, and I don't think that's the right approach. Once again, let's cut Medicare. It's a cut in benefits. If you have to wait longer to get your Medicare, you're gonna experience a cut in benefits. The out-of-pocket, even now, with Medicare and Social Security, the out-of-pocket cost for Medicare eats up so much of the Social Security check. So if you're out of work, you're 65, you've been laid off, your Social Security hasn't started because that, as you know, is going up gradually. It'll be 67 under current law. How are you going to make ends meet? How are you going to pay for your health care? I think, as I mentioned at the beginning of the program, let's try to control health care costs overall and manage the Medicare savings in that environment. And that's why we need to wait and be prudent, see how the Affordable Care Act plays out in terms of savings.
We'll go to Derek, who's joining us on the Democratic line in Atlanta, Georgia.
Yes, thank y'all for C-SPAN. Greta, please don't cut me off. I have an answer for you, something which you said a little later on. In order to understand this, Social Security is not adding 1 penny to the deficit. Greta, I know you are quick to say that, you know, you just have two people paying in. But I'm a baby boomer. It used to be 16 to 1 paying in. That's the reason why you had a $2.5 million surplus that was borrowed from Social Security. Also, if you look at it, Medicare Part D is what's adding to the debt that George Bush and the Republicans put in, because you cannot negotiate a drug price. What you must look at also, you look at taking the cap off Social Security, where rich people don't have to pay on their income. All this is a myth that they are selling. The facts are, like I said, you're never going to have the exact amount of people paying in or drawing out. It's going to be on a graph. It's going to be up and down. But like I said, I'm a baby boomer, and we was paying in 16 to 1. Do not mess with Medicare, Medicaid, or Social Security.